Hematuria. Hematuria is blood in the urine. It can be visible blood that the patient sees and presents with, or it can be non-visible, picked up on a dipstick test. Hematuria has to have come from somewhere in the urinary tract. There are 2 kidneys, 2 ureters, bladder, prostate and urethra, and sometimes it comes off a lesion on the external genitalia. So when you think about hematuria, think of what could be causing it in those areas. Infection, cancer, stones or trauma. And of course that includes trauma such as cystoscopy or catheterization, as well as external trauma. The next thing to think about is how you would go about investigating hematuria. And investigations always start with a history and an examination. In the history, it's useful to know if the patient can see blood in the urine or has seen blood in the urine, and if they have any lower urinary tract symptoms. The age of the patient and gender are very important. Just bearing in mind your list of differential diagnosis, a young female is more likely to have a urinary tract infection, cystitis. Someone older, you may be thinking more of a malignant cause. Pain, obviously, could be a cause of a stone, infection or an inflammatory condition. The examination of hematuria patients can be relatively limited and focused. You have to ask yourself certain questions. Thinking of the urinary tract, can you feel a palpable mass in the kidney? Now, it's unusual to feel a mass in the kidney, but not impossible. It's certainly something that should be looked for. More importantly, perhaps, a mass arising from the pelvis. This could be a full bladder rather than a malignant mass, and that should be borne in mind. Examination of the external genitalia is important. Things like phimosis can easily be missed, as well as rarer things such as penile or vulval cancer. In females, it's useful to know the estrogen state of the vulva. Soreness and breakage in the skin can lead to non-visible hematuria. Rectal examination is important to feel the size and consistency of the prostate, and also a pelvic examination in females in case there is a pelvic mass. Further investigations always start simple, so dip the urine. Is there blood there? But what you're actually asking about there is there an infection that needs treating? A formal midstream sample isn't required if you've already got non-visible hematuria on a dipstick. Different centres use different imaging. Here we tend to use ultrasound scan of the renal tract in association with a flexible cystoscopy. So the ultrasound looks at the kidneys, cystoscopy looks at the bladder. Some centres may use CT urogram as a first investigation.